I think we're on now. Good day, everybody. Welcome to Dental Voice Season 2 with Xyrus. Thank you for joining. My name is Rolando Mia. Today, we have a returning guest. I'm really excited to hear an update from Dr. Charles Schlesinger, Dr. Chuck Schlesinger. About 5 months ago, he joined us on Dental Voice, and he shared with us his insights, kind of what he was dealing with regard to his practice and practices. And he gets to come back now, and we get to find out what happened. Dr. Charles, Dr. Chuck, how are you?
I'm great, Rolando. How are you doing today?
Very well, thank you. And really appreciate you joining, and thank you for taking the time to spend with us. So first of all, it's been about 5 months now, and we're back to working. You're back to working. In a nutshell, how is it going? How are you doing? How is your practice doing?
Actually, great. We are busy, and I think most of what was projected we did see, and I think that most practices we came out of the box with an extremely large backlog of work to be done, which was great. So we were super busy, and started to level off a little bit at this point, but we're still at levels that far exceeding what we thought we were going to do. And the year's going to be good. So I'm happy the way that we recovered from 3 months of being shut down. Absolutely.
So when we were on before, you mentioned that dentistry today is not just about clinical, although clinical is a really key aspect of it, and it's paramount to what you do, patient care. There's also a kind of a business side associated with it. Do you see that playing? And would you say that's part of what kind of is helping you through all of this business?
Actually, I do. I truly think even nowadays, it's the business side is even more important, or not just the business side, but everything in addition to the clinical side, because we're doing the same things that we were doing before clinically, right? We're still providing the same kind of care. We're doing it a little bit differently, obviously, with taking into account the precautions that we're doing for COVID. But we're doing dentistry. It's everything else surrounding dentistry that has, I think, either makes or breaks a practice. And we have looked at it intently. We've done a lot of things. We've instituted, as we talked about 5 months ago, we were going to institute a number of things into our practice, and we have. And those things have worked out tremendously well for us. Not to say that everything that we've tried has been perfect, but the majority of the stuff that we've done, I think, is going to be, as we talked about, the new norm. Even though we've got new norms on the clinical side, I think we have new norms on the business side and on the practice management side that will never go back to the way that we did before, because it's just more efficient the way we do it now.
Wow. So let me ask you this. In our last discussion, you mentioned, or you made a reference to having to think out of the box.
Yeah.
Would you say are top three or things for looking outside of the box that people can do right now with regard to maintaining and keeping and thriving?
I would say what you need to do is, and this is what we did, we specifically looked at the communities where our offices are at. And here in Albuquerque, it's kind of unique in the fact that we have an office that's on the east side of town, so east of the Rio Grande River. We have one that's on the west side of the Rio Grande River, and we have one that kind of straddles the river now. And here we've got just kind of this weird dynamic that people that live on the west side do not want to cross the river to come to the east side for whatever reason, even though it's a 7-mile drive, but it seems like the end of the earth, right? And coming from California, I find that really funny, because we'll drive an hour and a half to go to dinner, right? It's just different. So what we did is we really looked at the individual communities that we were in and kind of tried to tap into what was going on. So what we did is the office managers were really instrumental in this, and even the doctors at the different offices. And what we did is we started to get involved very early in the pandemic with getting on to social media with regard to local groups. We have one here. It's Albuquerque Dental Peeps. I'm sure every single city has one, something like this. And what I did and what we did, we just kind of started to listen to about what was going on. So we were getting an idea of what was happening in all the offices at that point. Then we were looking out at the communities that we were living in. So we have employees that live on the west side. We have employees that live on the east side. And we looked at it and we started to talk more about that and say, okay, well, what are you seeing? What is shut down? What is not shut down? What is important? What's not important to the patients? How do you feel we're going to be able to come back out of this and get patients to walk back into the office? Because really, they were terrified. When we started calling back up and saying, hey, guess what, guys, we're back open for business. It was not an easy sell for a lot of patients. Those patients that had treatment that either was bothering them or that they were waiting on, sure, they were an easy target to bring in. But we had a lot of patients that were like, well, are you sure this is safe? We've been hearing that it's not safe. And so we had to really change the way that we approach our patients in that respect. The other thing that we did was we made ourselves known to a lot of groups that we normally wouldn't have targeted to. And that has been really good for us. So for example, what we did here in Albuquerque was, one of my favorite things to do is to go out to microbreweries, and we have a lot of them here. And I spend a lot of time, without sounding like a lush, spend a lot of time socially with friends out at these. And so I got to know a lot of the people that work in the industry, and we started just talking, and we were talking even prior to the shutdown about the lack of dental insurance, for example, that they have. They work in hospitality industry, but not kind of at the high end of hospitality industry, so they don't have a lot of benefits. They really have very few. So what we did is just, I think it was about a month prior to everything getting shut down, I contacted the Brewers Guild in New Mexico and set up an appointment, and we sat down with their people, and I said, listen, I know for a fact there's a need here. So what we're going to do is we're going to construct a special plan for you guys specifically and take advantage of it. Let your employees do this. So we did this plan for them. And then when the shutdown happened, they were hit hard. They were immediately, every single brewery was closed. Every single one of these people was without a job, with no way to know if there was a job on the horizon for them. And so we reached back out, and they're a real good group in the fact that they started having online meetings. They start doing a lot of stuff for all the breweries here in New Mexico. And so what we ended up doing was saying, you know what, we know you guys are not working. We know you might have stuff that comes up. So initially, the situation that we had with them, there was a monthly fee that they could pay that was kind of like a membership plan that allowed them to get their dentistry at a discounted rate. So kind of like a membership plan that most offices have. What we did then is we reached back out to them about a month into things, so this must have been about early April, and said, you know what, we're waiving your monthly. For the next year, there's no monthly, but you guys get all the same benefits, so we want to see you come in. And that was fantastic. As soon as day one came that we were starting to be able to see patients on a regular or semi-regular basis, we had patients that were coming in. And it's for me, what's really satisfying about that is now we can go out and we see these people now that their things are kind of opened up, and they're just like, oh yeah, thanks. We really appreciate what you did. So the words kind of got around. So that's just one example of something that we've done to try to tap into a need that the community has. And I think that can be done anywhere. By any office, if they want to just look and see where there is a need, where they can fit into it. There's a lot of opportunities.
I love the innovation. I love, talk about outside of the box. Engaging in your local community and setting up special programs with them to enable them to gain access to excellent care. What a great idea. That is fantastic. I love that. Now, it's interesting. First of all, thank you for that. What a great idea.
Mm-hmm.
We are hearing and we're seeing that in the turn back on, as people coming back, Though the majority of practices are now starting back up, there are quite a few that are, I mean, it looks they're not starting up, or they're selling, or dentists who've been around for a while are retiring. Are you experiencing that? And are you seeing that kind of dynamic occurring where you are?
Yeah, absolutely. We're no different than any other part of the country. I think, coming back from the shutdown, it made people think in a lot of different ways. And so I think the number one was, you had a lot of dentists, you had a lot of employees that kind of looked at the situation and said, is this worth it for me anymore? And as much as I love dentistry, is it worth it for me to put my life, my family's life, my acquaintances' lives potentially in danger? Now, we know, and I feel, and I think we talked about this 5 months ago, we've been dealing with everything that sprays out of a patient's mouth for years. And this is just another one, right? Yeah. And, but I think what has happened is this really hit home. It really hit home because of just how the magnitude of it. So yeah, what we have seen is we've seen offices that were very slow to come back. Some of it because of not anticipating what they needed and not being ready with regard to PPE or other aspects of their office that needed to change. I think that there was a slow return by some offices just because they just weren't sure what they wanted to do. There definitely has been a migration of older dentists out of the industry because they've kind of said, you know what, I was planning to retire within the next couple of years. This is a perfect time. Sell my practice at this point. So we've seen practices for sale. We've seen a very big, at least in our offices, a big migration of patients from other offices, whether they were offices that were completely shut down or they're offices that have minimal hours and can't accommodate them. And so we really try to do everything we can to help those patients out. And that's been a big part of our growth over the last couple months. And that's what's really astounded me, because it's when I look every day and I'll walk in to the office and I'll see that we'll have 5 to 7 new patients, emergencies. We have no idea what we're seeing. One, it makes life very difficult and challenging at times in the office because you don't know what you're going to be treating. But we know that we're treating those patients, and then they're going to become one of our longtime patients and patients. And so our growth is big. We're seeing anywhere between, I think if we look at the monthly numbers, we're somewhere in the 35 to 45 new patients a month right now that we're seeing. And we're seeing an overall growth, at least in my practice, on the East Side practice. We're seeing, I think we're on track right now to end the year at about 123% of our 2019 numbers, which is blowing me away. And our other offices are doing really well. We've got growth that is going to exceed 2019 at both of those other offices. And it all comes back to our staff. Our staff has been incredible, and I think that anybody's success is how successful the people are that are around you. And what we did is, when we came back, we spent a lot of time, meeting with the staff, assuring them that we were going to provide the safest environment that we could, but there is no guarantee. And so it's your choice, and there's no hard feelings if you decide that you don't want to continue on. And we actually had a couple people that in some positions that said, you know what, this is not for me anymore. I just don't want to do it. Some of them had some pre-existing health conditions that if I had the same thing, I probably would say, you know what, why expose myself to something like this if I don't have to? And then we had just a couple people that ended up leaving the practice, and the practices, just because life under the new way of doing dentistry was not what they wanted to do. And I can respect that. It's not hard. It's not easy. It's tough. It's definitely has its challenges. And, I feel it's getting easier at this point, but believe me, those first few weeks when we did, my assistants and I were looking at each other going, are you kidding me? How long till I can retire? Literally it's that bad.
Wow, wow. So have you had difficulty because people are transitioning out? Have you had difficulty, or what's it been like getting new members to join you?
It's been a struggle. It's definitely been a
Mm.
struggle. I think that on the front office side, it has been hard to find good personnel. I think that we've been lucky. We brought on two new office managers about 2 months ago, and they both came from existing dental practices. So that was great. We didn't have to teach them. They we had to break them of habits that they may have had, but overall they knew what they were doing, and we didn't have to start from scratch. But it's tough. There's not a lot out there because I think you've had offices that have closed or offices that have shut down, and those people, instead of wanting to stay in the industry, a good percentage of them have decided to just leave the industry for something else. And therefore we don't have this flood of an excess amount of individuals. And we see here also, again, I always go back to geographics. We have an assistant who is moving. So for example, we here in Albuquerque, very, very difficult to find an assistant sometimes because there's just not a big patient pool. We're talking about a state that has about 2 million people in the whole state. We have less than 1 million people in the surrounding Albuquerque area. So that's very different than this assistant who is now moving to Houston, and she put out her feelers and went online, and she's like, there was 65 jobs available. So the population's a lot bigger, and so depending upon where you live, think about it. If you were a dentist that was a dentist in Santa Barbara versus a dentist in LA, what would be the difference in your ability to grab new employees? So yeah, it's been a challenge. We're very thankful for the quality of people that we have brought into our group. We also take a very different approach with our employees that it's an interview both ways. And we do not only the face-to-face interview to meet, but we also do working interviews. And we might do a couple of them. We might bring somebody in and do 3 or 4 working interviews before we decide or they decide. And then we sit down with them and say, okay, what do you think about what we do? No hard feelings. You hate coming into our office every day. Fantastic. No problem at all. Much rather have you go find someplace else and be happy.
Right.
But what we do is we do that, and then we try to indoctrinate them into our culture. And our culture is patient-centered. It is doing everything we can for the patient, and at the same time enjoying your day at work. And that is the biggest thing. We work very hard, but we want to enjoy it. Sometimes it's not going to be fun. Most of the time it's going to be tolerable, and hopefully more often than not, it's a lot of fun. And so we try to do that, and we make sure that they are an individual that fits into that model, because that to me is the most important thing. We can teach the detail aspect of either front or back. But it's the person themselves. And if they don't fit from a personality point of view, then it really is not going to be good for what we need.
I love the fact that you use a two-way engagement where you give both the person who's looking and you an opportunity to work with each other. And then if it doesn't work, hey, better to find it out then than after you've gone through it. So what a phenomenal thing.
Like David. Yeah.
Let me ask you this. We just recently had Stan Bergman on, and he was talking all about infection control. And when you look at the CDC and when you look at the guidance that's come out, or the aerosols, it's pretty much, COVID is going to be in the aerosols. How is that the process of maintaining your infection control protocols, dealing with aerosols? How is that happening in your practice? And are the things you put in place working, and are you happy with them?
Sure. So yeah, it was definitely a challenge, because I think there wasn't a lot of concrete information for us coming out of this. And then we, in particular, we were given about a 1-week notice of reopening. That's basically what it was. New Mexico board was going back and forth. They were saying, well, we think we're going to do this. We think we're going to do that. Then all of a sudden they're like, hey, guess what, guys? We're going to open. But you need to satisfy certain requirements before you will be allowed to open. So, the biggest thing obviously was procurement of PPE and procuring the right PPE. And that was really tough because at that point, we were reaching out to all of our suppliers and everybody was like, we don't have anything, sorry. The rest of the world has taken it all from us. So we don't have it anymore. So there was a little bit of a panic moment. The New Mexico Board of Dental and the New Mexico Health Board really stepped up, and they got a program where they got PPE to us to get things started, to kind of bridge that gap. So I feel very indebted to them for doing something like that for us. We got out there. What we did is we obviously followed all of the CDC guidelines. That was kind of where we looked as the guidance, rather than looking at all of the other fluff that was going on around the internet and everything. I mean, it was a free for-all, and it was really hard to tell whether something was being advertised as the latest and greatest because they were trying to sell a product, or whether it was actually useful. And there wasn't really on the early on. And I think now we've got a much better handle on this. So what we did is obviously the regular, PPE with gowns and gowns and masks. We run everybody in the back wears double masks. So we run either a KN95 or an N95, and then a standard mask over it, either a level 1 or a level 2. That way we can reuse those KN95s. Usually what we end up doing is we use them for a week. At night, the masks all go into an area and then they're UV sterilized. So we're utilizing UV sterilization for that. The folks in the front, we have plexiglass barriers like everybody else. We've got a standalone machine for sanitizer. Patients. So what we did is we moved to everything being online. So the patients fill out all their paperwork online. That's all sent to them through our practice software. Basically, they show up, they land in our parking lot, they give our office a call or a text, say, hey, I'm here. Great. They come to the front. When they're ready, releases them to the front door. They come to the front door, temperature checked, disinfected. They sign their COVID paperwork that they need to sign because there's a final thing that they need to sign in on. They do that. We have dirty pens, clean pens, just like everybody else does. And then we bring them back and back in the operatories. Like I said, we've upped our game with regard to our personal PPE. And I think that's also an interesting conversation with the patients, because many times the patients are worried about that they're going to catch something within the office. And we really need to let them know, no, we're wearing this stuff because we're going to catch something potentially from you. It's not going to go the other way around. Then coming back into the operatories, they do see differences. They see differences in the fact that we do a pre-treatment rinse. So it's a peroxide-based rinse that we use. And they do that. Then we come back and then we've instituted isodries and isolites, which has been great. It's one of those things that it has made patients feel more comfortable with respect to knowing that we are doing something that's not what they had before. And it's funny because we do see a lot of patients that come in from either other offices that are still open or offices that they hadn't been to prior to COVID, and they see such a big difference. And backtracking, as you said, you've got offices out there that weren't ready to open up. Unfortunately, there were offices out there that were running game as usual through this whole thing. And it's really scary. And patients, I think, figured it out, because we do get a lot of patients that have come in and said, I went to another office and I just didn't feel comfortable. You guys are on top of it. Your front is spraying everything, with every disinfectant that you can imagine. You guys took our temperatures. You did this. My other office didn't do this. You brought us into the back. Nobody was wearing anything. They were wearing their regular. There were no gowns. There were no head covers. There was nothing. So patients see a lot of that. And once they do see it, then it makes them comfortable. And then they also tell other people. And I think that's another part of the growth that we've had has been the referral that we've had from a lot of people going, hey, we really respect what you're doing. We understand it's a tough environment. So we did all that as far as, cleaning and everything. Everything is basically the standards that we've always followed. What we do is we do fog the offices every night with hypochlorous acid fog. So I get dressed up at the end of the day and I look like I'm Ghostbusters, and I go around fogging, looking for ghosts, and and we're obviously cleaning everything every single day. I'm wondering what the long-term effects of smelling bleach and Pine Sol is going to be like. But it is what it is, and I'm okay with it, and our staff is okay with it, and that's the big thing, is because I think that we're being so successful because our staff is comfortable that we're doing everything we possibly can for their safety also. Not only the patients, but our own employees. And that was a big thing with our hygiene department. They're going to use ultrasonics. Hygienists have always been very conscious about cross-contamination, about aerosols, about things like that. And it was a concern with some of our hygienists initially of, well, wait a second, you still want me to do this? I realize I'm going to be generating a ton of aerosols. There was a lot of conversation that I kind of sat in the background during the time that we were off. That was some of the hygiene groups talking back and forth about, well, how are we going to move forward? And everything was around suction devices and ways to suck up aerosol. And it was fun to kind of watch, because I've seen, as we all have, the devices from the giant vacuums that are over the top of the patient's head that you can't hear anything in the operatory when they're going on. And I have a good friend who has one of those, and it works great for them. But I was like, wow, I'm going to have to wear earplugs if I was to work here. And so we looked at a lot of different products, and obviously you and I have had a relationship for quite a while, and it fit in perfectly with what we needed to do. And most importantly, it made our employees comfortable working in this environment, and made our patients understand that we were putting forth an effort to mitigate the potentials. We're never going to be able to get rid of it all. We can get close, but we can't get rid of it all.
Did you have difficulty? Because hygiene, we've heard a lot of times that on the hygiene side, there's a difficulty in adopting the Isolite. Did you run into that because of kind of as you mentioned, there's a habit going through, or did they adopt the system quickly? I'm curious.
No, it did. We did have, it wasn't a perfect integration, obviously. And it is a change in paradigm. It's a change in paradigm of, okay, well, now I've got to implement this when I'm doing work. I'm going to have to place it correctly, because if I don't place it correctly, then the patient's going to be uncomfortable, and they're not going to want to do it, or it's not going to be effective to do the things that we need to do. So there was some training that was involved in that. And realistically, I'll be honest with you. We had an employee that wanted it. We brought it in, and then it wasn't used. And we said, you've got to use this. And why aren't you? And then there was a couple of
the employee didn't want to use the Icelight at all.
Right.
After asking for it.
After asking for it, and then saying, no, it's too difficult. This, to that. We trained them. We did everything. We talked to some of the support at Xyrus to try to figure this out. And it ended up being not necessarily that it was the product that was the problem. It was the individual just really didn't want to be in this environment. And that's what it came down to. But it was a long, circuitous route to get to that point, to say, well, really, what do you want? How do you want to do this? So, but it is a learning curve, obviously. And it is a different way of doing dentistry and doing hygiene. But I believe that it's a necessary part of what we're going to do now. And the benefit is probably going to be better. I'm curious to see how many little sniffly colds I get in the next couple of years versus every year getting one or two little things that are going to bug me for a couple months. So
that is cool.
I think it's going to be good. As we said when we met last time, things are going to change, and many of them are going to be permanent changes. And I truly think that a lot of this on the PPE side and a lot of it on the infection control side is just moving our game up one more level. And it is going to be the way that we proceed with dentistry from here on out until the next group of things come around.
Well, I love the fact that things are going well. I appreciate the comments about Icelight and everything. Always, thank you for that. That's not the purpose of this.
I wouldn't talk about a product if I didn't believe in it. That's definitely something that I never do. And if I don't personally use it, then why would I tell somebody else to do it? So,
thank you.
My disclaimer that goes across the bottom of the screen.
Thank you for that. Now, let me ask you this. From a going forward perspective, encapsulating everything that you've been talking about, if you were to speak to your community and kind of send a message out for the viewers who are going to be seeing this, what is that message that you want to send about with regard to your practice, with regard to dentistry overall, and then just also with regard to COVID? What would you want to say to them to kind of reassure them that we are going to get through this?
Well, I think it's a two-pronged answer. One is the answer to the general public that's out there that is looking at, is it safe for me to go in and have dental care? And then I think that the second prong is my fellow practitioners. So I'll address both of them for you if you don't mind. As far as patients go, I think that every office needs to assure their patients that, and if they are doing this, that they are doing everything they possibly can to keep them safe. And in today's world, even with tracking and all that, it really is almost impossible to know where that magic moment is that you get exposed. And unless, obviously you go to a large party and half the people go down with it. But, we've told patients, I've had conversations with patients where they're like, well, do you feel that it's safe? Do you feel it's this? And the front office has had that. And we assure them that, listen, we are probably one of the safest places. Dental offices are one of the safest places that you can be. The literature showing there's no transmittance from us. So you're not going to catch anything from us. And the chance of you contracting COVID is much, much higher by going to your grocery store or walking into Walmart or going out to eat, or any other large gathering that you may get in or in close contact with people. We are doing everything we possibly can. And what I think is really funny is that a lot of these same patients don't necessarily have those biases when they look at medicine. And they go, well, I'm going to go to the hospital. The hospital's doing everything. I will put my office up against any hospital as far as, and I think most dentists could say that we do a darn good job of mitigating potential problems in our office. And we've always been at the forefront of infection control, way more than medicine has been. And obviously they've caught up. They've had to catch up here. And I know I've talked to my own personal physician, and she was just like, oh, and I got to wear gloves and I got to do this. And I'm like, we do that all the time. Last time I saw her, I had to go in for an exam, and she was wearing eye protection. And she's like, they're making us wear eye protection. I don't understand why. And I'm like, you know what? It is. Yeah. Sorry. But we do this every day. But anyway, I think from the patient perspective, we as practitioners have to be all on the same page that we are doing the very best that we can for them. Dentistry is essential, that we are seeing more and more related things that have occurred just since the pandemic has hit and everybody's been wearing masks. The incidence of oral bacterial infections, the incidence of fungal infections, from the increased stress of living, we're seeing that huge rise in cracked teeth syndrome. All these things are happening, and we tell our patients you can't not come in, because you're going to end up in a situation that we're not going to have any choice to be able to help you. And we've had a couple of those patients that came in and they're like, I'm like, well, all we can do is take this tooth out at this point. Well, why? Well, you waited. You waited this time. If you would have come in 3 months ago, we probably could have done something, but now we can't. So that's the one side of it. I think for my fellow practitioners out there, I think, stay the course and do the things that you need to do. We're going to get past this. Your offices need to just continue on doing the dentistry that you're doing, and then focus on getting the patients comfortably through your door. And if you can do that, we can ride this out for whatever it's going to take. I mean, the numbers change every day. I've heard, we're going to be wearing masks until 2022. I've heard that we're going to be done with masks in 2021. I've heard we're going to be done with masks on November 4th. I mean, you never know. I mean, who knows? Who knows what's going on? But I think that dentistry has come back. And I truly believe that. And we see that because I get to talk with practitioners from around the country. I am very active in online groups, not only locally, but national groups that are out there where you get to hear what's going on with doctors. And I've gotten a chance, I'm, still on education side doing a lot of webinars. I did a live course actually a couple weeks ago. And it was very enlightening to talk to some of these doctors that were from all over the country and just say, well, what are you seeing? Are you guys busy? Or everybody was busy. Everybody was busy. And the unknown was, how long is this going to last? Is there going to be a drop off? Is there going to be that hygiene drop off, which is going to directly relate to a patient treatment drop off? It might happen. But I think if you've got to leverage yourself in such a way, and you've got to market also. And that's one thing that we have done a lot. We threw a lot of money into marketing during this time. And some of our marketing, we kind of have different target groups that we go after. And we have a target group that is geriatrics. And so the advertising that we go to there is all about, hey, this is what we're doing to keep things for you, so you're safe and you're healthy, and this is what you need to do. Writing. I wrote an article for one of the retirement newspapers about mask mouth and all the things that are going on and why you should come into the dentist, and here's what we are doing to keep you healthy. And then we had an ad that listed those things out at bullet points, and so we're going to get through this. We just need to move forward and don't get discouraged. Don't give up. Know that we are essential, and just hang in there, because you can get through whatever tough times that you're having right now, and just build your staff, build your clientele.
That is so cool. We have, check this out.
So Angela, that's, that was unexpected. We had no idea that was ever going to happen. And it was funny because my wife's, one of her extended family members, we were talking online to them, and she had said she just went to the dentist. And my wife's daughter had come to our office and had a side conversation with this individual and said, oh, well, we had to do this and we had to do this, and they made us take our temperature and this. And so we're on the line, we're talking with her, and she said, well, my dentist never did that. I went in just like it was before. Should I have gone in? Should I find somebody else? And I didn't want to, I was like, well, maybe you should. But yeah, that was, it was really unexpected to hear that from patients, and that patients were so aware of it. Because a lot of times we don't really know what patients notice and what they don't notice in your office. Occasionally they'll come in and they'll say, oh, you got a new haircut, or a picture on the wall. But normally they don't really comment too much on that. But we have had a very large percentage of patients who have come in, especially on the emergency side, who have made comments about how we are running our office. And that makes me feel good that we're doing the right thing.
That is cool. That is cool. So, hey, first of all, So appreciate some really interesting nuggets here, really cool things.
Mhm.
If people wanted to contact you, what would be the best way to contact you?
Email is the best. And you guys can put that out. I mean, it's just cdschlesinger@gmail.com. Maybe when you guys put this together in post-production, throw
And
it
what's
on.
your website? The website for your practice is?
So the website for our practice is Comfortable Dentistry for You, and that's the number 4 and the letter U. And then my other website, which is more about my teaching side of things, is the cdschlesingergroup.com. So,
Very good.
But you can contact me through any of those things or through my personal email. And I'm really good about getting back to people in a very short period of time because I love the interaction. For me, it's a community that's large but small at the same time, and it's a great profession, and I think that we all have to be out there to help each other out. And yes, we're competitive with other people within our own city, but it's interesting. We're competitive with a lot of the other doctors that are in our town, but we also have a very large referral base from other GPs that send to us knowing that we're going to do some of the procedures they don't do, and the patients are going to go right back to them. And so that, at least I think, has leveraged myself in our practices as that we're helping people out. Or we have doctors that say, well, I'm interested in implants or whatever. Fine, I'll teach you how to place implants. I'll help you get started in your practice. You're not going to take stuff away from me. If anything, it's going to open up the opportunity for you to potentially refer more to me. And so that's the way I look at it. None of this stuff is proprietary. None of this stuff is the magic bullet. I think you can get a general idea of how other people are doing things, but you're going to have to adapt it and take the effort to turn it into yours. And that's what you really need to do. You have to take ideas, take the good that's out there, those special pearls that you hear, but you have to make them your own. Because if you try to throw them out there as a generic answer for something, it's probably not going to work out as well as you think it is.
That's cool. First of all, thank you for that. All right. I know you've been here. I really appreciate you taking the time, but you also have a hobby. I just want you to show one of the things. You gotta. I mean, we're here, right? What do you make?
So I build guitars. And
show me one. You got to show us one.
So there's one.
Holy cow.
So yeah, just, it's a little something that I do when I'm not doing dentistry. And for me, it's therapeutic because I can go and lock myself into my workshop, and I can turn the music on, and I can just do what I need to do. Just create, yeah, without expectation. And yeah, it's something I love to do, and I'm hoping to do more of it. I gotta get all the practices to a point that I can work less and I can do this more. So that's the goal.
Thank you so much. Thank you for spending the time. Thank you for joining us back. I'm going to ask 3 whatever months from now, as we get further in, would you be willing to come back and share more of the stuff that you're learning and all that?
Excellent. Absolutely. This is wonderful. I love being a part of groups like this. I think this is a great service, Rolando, for all those that watch. There's not enough of this out there where we really get to talk to each other, in a casual setting, and we're all dealing with the same stuff. So we might as well learn from each other. So,
thank you so much.
I'm more than happy to see you in a few months.
Awesome. Hey, those of you who've been here, first of all, thank you, Dr. Charles Schlesinger, Dr. Chuck. Really appreciate that. If you like the content of this, please share. We went a bit longer here, but the things you're saying are phenomenal, and I really appreciate that. If you have questions, please ask. Please feel free to reach out to Dr. Schlesinger. If you have any questions about or need anything from us, or if you want us to cover other things, please let us know. Have a wonderful, safe, and restful rest of the day and weekend, and look forward to seeing you at some time soon.
Same to you. Thank you, Rolando.
Thank you, sir. Appreciate it.
Awesome.